Doctor, we're talking about sinusitis, and the first question is, what is sinusitis?
Well, sinusitis is usually an inflammation or an infection of your sinuses. Now, you have several different sinuses. So inflammation would be usually you'll run a low-grade fever, you'll get a lot of pressure around your eyes, you'll have sometimes nasal discharge that's colored, and you'll have difficulty breathing through your nose.
How common is the condition?
It's actually fairly common. Several things that will set off your sinus infections, and one of them is smoking. It's more common here in East Texas because we do have a large number of people who smoke. Secondhand smoking can irritate your sinuses, as well as things in your environment, air pollution and allergies. So a lot of people are going to have more common side effects of acute sinusitis after viral infections too. So influenza, the common cold, will cause the sinusitis. Other things that are going to make you more likely to have sinusitis, it can be a nasal obstruction problem. So you can have broken your nose, you can have an old deviated septum, you can have nasal polyps. Those things are going to make it more likely. So sinusitis actually is a fairly common problem in the population.
You mentioned allergies. Can things such as allergies be confused with sinusitis?
It can, and a lot of times things that people will say they have allergies, and it turns out they have sinuses. More commonly with allergies is a runny nose, itchy eyes, and it's clear nasal discharge. You shouldn't really get a lot of headache or fever or other symptoms like that would lead more like toward an infection.
Okay. Well, if you do have sinusitis, how is it treated?
The way we differentiate sinusitis is between acute and chronic. Acute sinusitis is somebody who gets a viral infection and then develops a cough, postnasal drip, color in their nasal discharge, or they start coughing up some phlegm that's color in it, pain that doesn't go away, headache, low-grade fever. Most acute sinusitis can be treated symptomatically. We use a lot of salt water in the nose, nasal washes, decongestants, and you can use Tylenol or aspirin for pain.
And that probably leads into our next question. What are some comfort measures, aside from what you've just said, that can be used to combat the discomfort?
That's the most common. Now, in East Texas, when we hit our big pollen season, you can actually have symptoms without really being allergic, just because there's so much particles in the air. The other causes of sinus infections can be air pollution, and when our pollen is so heavy that everything is yellow or green, your nose is filtering those particles, and that's what sets up a lot of the inflammation.
When should I, with respect to this condition, sinusitis, when should I see a doctor?
By using the regular comfort measures with using salt water, nasal sprays, sinus rinses that you can buy over the counter. If you run a fever, you need to notify your doctor. If you have persistent pain that doesn't go away with Tylenol or aspirin, if you have swelling around your eyes or over your sinuses, that's under your eyes, in between your eyes. If you have any trouble with blurred vision, trouble thinking, things, lethargy, you're sleepy, things like that, you need to see your doctor right away.
Okay. You mentioned a moment ago chronic and acute. How do we differentiate? How do I know it's become chronic?
Chronic sinusitis is usually somebody that has the signs of acute that last over a month. And they have episodes more than 4 times a year of sinus problems or sinus infections.
Okay. Are there any treatments, medications that are new that are in the pipeline for treating sinusitis?
There are several things that they're looking at for treating sinusitis. One is because the bacteria that cause it, and not all sinusitis needs to be treated with the antibiotics. The concern, if you treat too much with antibiotics, you'll develop resistant strains. And so what they're actually looking at is the type of bacteria that cause the sinuses. They're more common with 3 types of bacteria, is vaccinations against that type of bacteria. The pneumonia vaccine is one type of vaccine that will help chronic sinusitis. They're also looking at the type of cells that produce the mucus in your sinuses, and how to block them from producing as much mucus or inflammation in your sinuses.
How will that be delivered? Is that an oral pill or is it a spray, or how will that work?
Most of them are looking at sprays that are targeted directly toward the cells. I think there are a few oral ones, that they're looking at as well.
And what other health problems can sinusitis cause?
People who have sinusitis frequently will exacerbate their asthma, their COPD. People who have obstructive sleep apnea and wear CPAP machines have difficulty breathing through their machine, and so they don't wear it, and they develop more side effects of their sleep apnea. The worst case is if you develop a bad sinus infection that's not treated. It can lead to meningitis.
Very well. Thank you very much, Doctor.